You're listening to the Doctor Is In podcast, brought to you by MartinClinic.com. During the episode, the doctors share a lot of information. As awesome as the info may be, it is not intended to diagnose, cure, treat, or prevent any disease. It's strictly for informational purposes.
Hi, this is Dr. Martin Sr., and I am going to go solo again today as we talk today about the similarities of two very common cancers. And today I want to talk to you about breast cancer and prostate cancer. It's funny because in the office, and I believe this is episode 196. I hope I'm right with the numbers. Patients are often taken back when I talk to them about, especially if I have a couple in the office, husband and wife, and I'll talk to them about breast cancer and prostate cancer being essentially the same cancer in the sense that both of them are caused by two hormones. The major cause of breast cancer and prostate cancer are hormonal cancers. And, you know, I've had women tell me that, well, doc, listen, my cancer, breast cancer, was not receptive to estrogen. And I tell in very respectful tone, I'll say, well, all cancers are receptive to estrogen, and especially breast cancer. Breast cancer cells are 6 times more receptive to estrogen and hundreds of times more receptive to insulin than anything else. And men, it's the same for you. Prostate cancer is very receptive to estrogen and insulin. Now let's give a little bit of history here. Breast cancer and prostate cancer are like epidemics today, and I don't want to use the word epidemic lightly. I say it because of what statistics tell us. Now, when I graduated 45 years ago in the 1970s, 1 out of 20 Canadian, and I'm sure American women, I always lump the Canadians and Americans together. We have the same lifestyle. We have the same, really the same environment, and we have the same nutritional standards, probably to my lovely American friends and patients. You eat more sugar than we do, although we're carboholics. But in the 1970s, when I graduated, 1 out of 20 North American women and 1 out of 20 Canadian men, and again, American men, would get prostate cancer, 1 out of 20. Well, today, we're at about 1 out of 6 Canadian women and 1 out of 4 Canadian men over the age of 50 will get prostate cancer. So for all the tea in China that we're spending, all the money we're spending with the pink ribbons and the breast cancer awareness and grow a mustache in November for prostate cancer, in spite of all the money that we are spending on cancer research, we're really looking for love in all the wrong places. And this is why I am so adamant about the actual causes. Why don't we look for causes? We're looking for medication. You know, the cancer industry and the medical industry is, look, once you get cancer, I've never seen a system. It's incredible. The pressure they put on, I see probably 1,000 cancer patients a year. And when it's amazing once you get the diagnosis. For example, let's look at breast cancer. Your lady's in the shower, and this is not a bad idea, by the way. Do a self-examination. I'm much for that. Absolutely. But, you feel a little lump or little change in your breast, or you see a visible change on your nipple or whatever. And, listen, this is you seeing what your body is like, and you know what it's like. And I feel a little bit of a lump, and you go to your doctor and you're concerned, and the doctor's concerned too, and they should be. And you know what? We'll set you up for a mammogram, and then you get a mammogram. And, a lot of times with mammograms, you get a false positive, or, it's not always reliable. But if they suspect something on the mammogram, oftentimes now it's a biopsy, and the biopsy, you wait a couple of weeks in a deep sweat waiting for results. And then if you get a call from your doctor, it's usually bad news. Doctors don't call you to give you good news. They usually call you to give you bad news. And you know what? You got cancer. You got to come in right away. And now you got to make a decision within 24 hours, okay? Like, we're going to do a lumpectomy. We're going to do chemotherapy, radiation. You're going to see the oncologist in the next few days. And it's amazing how fast things happen that were not happening quickly before. And, listen, and I know the motives are good. I really do. I understand that. The motives are good. They want to get you, but you know what? Listen, if you can feel a cancer, if you can actually feel a lump in your breast, ladies, you've had that cancer for a good 10 years. That's a fact. Cancer is it's never rapid growing until the late stages. So cancer, for you to feel it, would be in your body for 10 years. And now the cancer industry goes crazy. And man, oh man, you got to make big time life-changing decisions in a very short period of time. And, I've had women, and just for example, that have said, you know what, doc, I want to think about it. I'm not sure if I want to go through chemotherapy and then be on tamoxifen, which is a estrogen blocking drug, for 5 years. And I want to think about it. And you know what? You're under a lot of pressure from your family, from medicine in general. And, again, I'm not questioning their motives. I'm not. It's what they do. It's what they know. I've had a few oncologist friends say, this is what we do. This is what we know. And this is why we are in a hurry to get it done. And you know what? I don't want to really even talk about the treatment and what happens when you get cancer. I want to talk today about how to prevent these two epidemics in cancer, and that is the cancer of breast cancer and the cancer of prostate cancer. Because there are two hormones, and I mentioned them already, estrogen and insulin. They're at the root causes of these diseases. Now, let's start off with estrogen. Now, we've mentioned this many a times on our podcast. Estrogen makes you a woman and will make a man a woman too. When we talked about testosterone in a few of our podcasts, we talk about the male hormone testosterone. You know that a lot of men, especially when they get into their late 40s and 50s, is there such a thing as andropause? Men are big babies. So if we really went into like a menopause type of thing, we would probably go out and shoot ourselves. I mean, any changes, men are babies compared to women. But anyway, when men hit a certain age, and not all men, but a lot of men, because their testosterone is sinking like the Titanic, you lose a lot of testosterone men starting at a very young age, and it'll go down unless you are very proactive in keeping your testosterone up. But your estrogen levels in a man are directly proportional to testosterone. So as testosterone goes down in men, they get that little sugar belly or beer belly, and they're not as, they're tired. When they're tired at night, and, they don't have the same vitality, they don't have the same sex drive, they don't have even the same outlook on life as they used to. Things are going downhill, and this is low testosterone, low T. And low testosterone, the hormone that will take over in men, is estrogen. And like I said, a lot of men, husbands, have more estrogen, the womanly hormone, than their wives do. Of course, when women hit menopause or they become perimenopausal, their estrogen is going down. And men oftentimes have more estrogen than their wives, and that is never to be the case. Even though women, as they hit their menopausal years, of course their estrogen is coming down. But women, listen to this, ladies, because women think, well, I got no, I've had a hysterectomy, doc, I have no more estrogen. Hey, God has plan B. You're still producing estrogen. Your adrenal glands will produce estrogen. So you're never going to stop being a woman. Even when you're menopausal, you still make estrogen. You just don't make them as much, but your cells are receptive to that estrogen. If your progesterone, ladies is balance. Men, it's not a balance thing. You need to have high levels, but women, you need to have a balance between estrogen and progesterone. And ladies, if you see that, for example, you're getting irregular periods, if you're perimenopausal or heavy periods that you never had before, you might have acne that you never had before, breast tenderness, sugar cravings, water retention, weight gain, these are all signs that you're still dominant in estrogen as compared to your progesterone, and this makes you much more receptive to breast cancer. And so cancer cells are very receptive to estrogen. You must get your estrogen down. This is why we love our hormonal support, because it is meant to block estrogen. I get women that are 70 years old still blocking estrogen. Okay, on thermography, we see their estrogen on their body. We see it on their chest wall. And ladies, you might feel wonderful and everything, but you might have estrogen in the wrong places. Estrogen might be sitting on your chest wall, and you would never know it. And this makes you much more susceptible to breast cancer. So estrogen, remember, we live in an estrogen crazy world. Estrogen is everywhere. It's in your kitchen. It's in your bathroom. It's in your food. It's in your drinking water. It's in everything. You cannot get away from estrogen. The xenoestrogens, and with the herbicides and the pesticides and the plastics and the makeup and the underarm deodorant and the air fresheners and the chemical cleaners. I tell you guys, there's no getting away from it for women and men. And this is one of the reasons that we're losing the war on cancer. Cancer is so much more prevalent today because of estrogen. And never touch soy. Never touch soy. And this is where I'm concerned, and I'll just go here sideways just for a second. This is where I'm concerned about this meatless world that we're going into, and a lot of meat substitutes are made with soy. And I tell people, don't eat soy. You don't need soy. Soy mimics estrogen in your body. So, ladies and gentlemen, stay away from soy. Okay. Now, the other hormone, one is estrogen, and the other one is insulin. I tell you, folks, that cancer cells are 100 times more receptive to insulin. Cancer cells in the breast, cancer cells in your ovaries, ladies, cancer cells in your uterus. Cancer cells are 100 times more receptive to insulin. Insulin is a death hormone today because we use so much insulin because of the amount of sugars that we have and we consume in our diets today. And guys, listen, you need to understand this. When you are eating bread and pasta and cereals and yogurt. Oh, Dr. Martin, I love my yogurt. Oh, yogurt. Okay, if it's plain Greek, which tastes like, I don't know, who likes plain Greek yogurt? And anyways, you know what? It's overrated. Milk, terrible, full of estrogen. What you get in your grocery stores is full of estrogen and full of sugar. You might as well be drinking Pepsi as drink milk. Stay away from it. You can have some cream, not milk. I'm not against dairy, but I'm against what ends up in the grocery stores, except for cheese. Because you want to keep your insulin down. Insulin, your body secretes insulin every time you eat, except if you eat fat. And this is why I am a real proponent of low-carb eating. If you've been following the Martin Clinic, some of my patients have been following me for 45 years of practice. I am a low-carb guy. I always have been a low-carb guy. And you'll never get me to change. I'm sorry. You know, keto is, now docs, everybody's asking me about keto, and this is the big keto. And, if you've read any of my books, and if you've read Serial Killers, 2 Hormones That Want You Dead, I was way ahead of the keto curve because I was talking about insulin. I don't care so much about keto. I'm more interested in insulin. How much insulin are you using? Why? Because insulin is a growth hormone. Insulin is a growth hormone, and with all the sugars Canadians consuming, and Americans are worth over 200 pounds of sugar a year, just read your labels. We are consuming an enormous amount of sugars. And what is this doing? This is making us much more. Remember your cancer cells. Everybody has cancer cells in their body. Your body is ready to fight cancer. Every day, your immune system, your T cells, your body's immune system is ready to fight cancer. We are exposed to cancer cells every day within the body, but your body's immune system is ready to fight. But what happens when you increase insulin? Well, I'll tell you, I always use the example of the PET scan. In our hometown, we have a PET scan, It's a wonderful imaging, better than the MRI for cancer. And guess how it works? You give them a glass of radioactive glucose, yes, sugar, and you light up like a Christmas tree if you've got cancer. Why is that? Sugar feeds cancer. And remember, every carb you eat, even if they're good carbs, are going to be sugar in 5 seconds. So don't fool yourself. Don't fool yourself. Carbs turned to sugars can feed cancer cells in a nanosecond. And this is why I am a one-trick pony when it comes to food. I'm always talking, I divide food by insulin and how much insulin you need to break down certain foods. And one thing about carbs, even if they're complex, I'm not against fruits and vegetables and legumes. I'm just telling you that you're still going to need a fair amount of insulin. And when you have bread, oh, doc, it's whole wheat. I don't care. Whole wheat is going to take only 1 more second than white flour to turn to sugar. Yes, and this is what feeds cancer. And men and women, you've got to get your estrogen down and get your insulin down. These are the 2 hormones that are feed cancer, okay? They feed cancer. And I just want to mention one thing. I mentioned this on a video, and I want to do it again today on this podcast. I want to talk about alcohol. And ladies, I'm going to aim this at you a little bit because, and I don't blame you, but, a woman's job never ends. It never ends. Women, I'm more classified as a woman doctor. And the reason is because I'm very focused on hormones. And very few doctors really look at the endocrine system properly. Endocrine just means hormonal system. And your endocrine system, so I'm more of a woman's doctor in a sense. Not that, I see thousands of men a year, but men are big babies. Medicine is uncomplicated for men. Women are complicated because they have hormones. You got hormones, ladies? Yes, you got hormones. And I don't care if you're menopausal, you still got hormones. And, women's hormones are very delicate, and they're very in subjection to balance, and you need to be balanced. But let me just say something about alcohol. And women have this habit, and not all women, but most women do, and it's become very popular today, and that is drinking wine when you get home at night and having a glass of wine. And I don't blame you. I don't blame you. You've had a tough day and your day's not over yet. You've got kids, you got a family, whatever. And, a nice little glass of wine at night. And I understand that. And to some extent, you think it's good for you. And there are some studies that have shown that, some wine, having a little, because of the antioxidants and the resveratrol that is in there, that is actually good for you. But guys, I want you to be very, very, ladies, I want you to be very careful with wine, because here's what happens with wine. Wine does not allow estrogen. So wine's going to make your insulin go up because it's going to go directly to your liver. It's going to be stored as fat. Remember that. And this is why in our weight loss clinic, we just don't let our patients have any alcohol till they get to their weight loss goals. We don't, because we know what alcohol does. And again, I'm not talking about the benefits of having a drink or two. Come on. But the problem is that just don't fool yourself, is that wine, and you're having that glass of wine, it will not allow estrogen to get metabolized in your liver, because that's where your liver is needed. Your liver is a place for metabolism. And your liver, think about it, even your thyroid hormones, where do they get metabolized? In your liver. Where does your estrogen get metabolized? In your liver. And when you drink wine, you do not metabolize all your estrogen, and then your cells become more receptive to estrogen. And so just remember that, okay? That, and it's sort of a by the way. But by the way, be careful. Okay, and I'm on your side. Ladies, you know me. I'm on your side. I want you. I understand my married for 47 years, and my wife, her day never ends. My wife is just constantly the ever-ready bunny. And I have to sit on her every once in a while just to keep her quiet, because if she's got something to do, and it used to be with the family, but it's still family. Now it's grandchildren. If I'd have known that grandchildren that much fun, we'd have had them first. But my wife is a servant in a lot of ways. She loves that. Her gift is hospitality, and she loves her grandchildren. Well, loves her kids too, but loves those grandchildren. They can get anything out of their grandmother. And she's always, I had a grandma like that too, by the way, that just waited on me hand and foot. Okay, so guys, thanks for listening. So remember the take-home points for breast cancer and prostate cancer, which are very similar cancers. They are receptive big time to estrogen, and they are receptive big time to insulin. These are things that you can help yourself with. Thanks for listening.
You've reached the end of another Doctor is In podcast with your hosts, Dr. Martin Jr. and Sr. Be sure to catch our next episode, and thanks for listening.